So lastly, almost lastly, I'm going to talk a little bit about a project that I'm a part of called SWASH Plus in Kenya. It's a 5-year applied research program, and SWASH Plus stands for Sustaining and Scaling School Wash, Water, Sanitation, and Hygiene Plus Community Impact. And it's a CRT. And what we mean CRT, what we mean by CRT is that it's a cluster randomized trial, meaning that we've assigned schools to receive different packages, and then we've tried to assess the impact of those packages on school absenteeism, pupil diarrhea, morbidity, helminth infection, community change, behavior change, and then children under 5 illness. There are 185 schools enrolled in the cluster randomized trial, and those different packages are, number 1, they receive a hygiene promotion and water treatment infrastructure and behavior change at the school. So this package, they get point of use water treatment products, hand washing containers, and education. The second package is the hygiene promotion, water treatment campaign plus sanitation. So in this case of Kenya, it's latrines constructed at school. And third is water treatment, hygiene promotion, sanitation plus water supply, and then we have our controls. And this is funded by the Bill and Melinda Gates Foundation. So here are some of the key impacts that we found, and these haven't been published yet, but they're in process. We found that for the first bullet here, when we looked at absenteeism, we found that there was no impact of the program overall on pupils. However, when we just looked at girls, there was a 58% reduction in absenteeism. Here we have something called a confidence interval. This confidence interval shows that this finding was not due to chance, and that's what we mean by a confidence interval. This is just the hygiene promotion and water treatment. And when you add sanitation, you see a 53% reduction. Now this is to say these two numbers, they are different, but I think the take-home message here is that what's important really is that first step of reducing transmission, and that transmission can be improved through a hygiene promotion and behavior change. With sanitation, you do run the risk, I think, of adding latrines if you don't have a comprehensive behavior change component and hand washing component along with it. Something that I haven't mentioned here on this slide that we found is that there was higher levels of fecal contamination on children's hands in the sanitation schools, meaning that unless the hygiene promotion and hand washing components were done very well and thoroughly, we actually put the children at greater risk by just building sanitation, by just building latrines, and not really doing a comprehensive hand washing promotion. We put children at risk. So the second bullet, actually I mentioned one of the packages included water provision, and we actually saw that there increased absenteeism. And actually what we think we're seeing is that it also increased enrollment. We added the water supply, either the rainwater harvesting or the borehole at the school. We actually increased enrollment at the school. So students were coming from further away in marginalized schools to schools that now had water. So we actually increased the access, enrollment, although, so that needs further investigation. The third bullet point here, we talk about ascaris infections. That's a soil-transmitted helminth infection. And we see that the hand washing and sanitation intervention reduced prevalence and worm burden, the reinfection, by 50%. So we dewormed, we took a sample of their feces of these children, then we dewormed them. And then 8 months and 10 months later, we came back and we saw that the reinfection was reduced in schools that had hand washing and sanitation. So that's what I was mentioning before when I was talking about that deworming study. Deworming is a critical component of a Wash in Schools program. However, and that needs to be done in conjunction with school-level improvements in wash infrastructure. And then the fourth point here I think is really important. We found that provision of water at the school increased even in schools where only hygiene education was provided. So by just adding, providing behavior change and some small infrastructure improvements, just some hand washing containers and drinking water storage containers, we increased provision of water in schools by 50%. And that schools were not given new supplies, new rainwater harvesting, none of that. It was just hygiene, behavior change, and some small infrastructure that cost $2 allowed greater provision of water at schools. Again, the take-home message I think here is that hygiene promotion and behavior change is the critical step that is often missed in some of these school infrastructure improvements. I want to talk about a second component of the data, the second component of the data that we're finding, and this is around equity. So what you see in the bottom, you see different levels of socioeconomic status. Okay, so we have here the least poor children and the poorest children. And as you can see in the black line, absenteeism goes up. This is the total, all the children. Absenteeism goes up from the least poor here to the most poor. And that's what we would expect. Poorer children are more likely to be absent from school. On the left side, you see absence by boys and girls. And you see that girls are more likely to be absent than boys. So what we have here is that poorer children are more likely to be absent than less poor children, and boys are girls are more likely to be absent than boys. However, what's interesting about this graph is that while at the beginning the least poor children seem to have similar levels of absence between boys and girls, at the poorest level, girls are way more likely to be absent than boys. So not only is gender an important component of absence, not only socioeconomic status an important issue of absence, but the two together create a multiplicative effect so that poor girls are even more likely to be absent than poor boys, which are both more likely to be absent than less poor children. This underscores the importance of looking at equity and trying to, and the role of school wash in reaching the most marginalized groups in the population. We'll talk about a few studies that look at behavior change and diffusion, and this will be covered in more depth in the Children as Change Agents module. But I wanted to talk about a paper that I have that's going to be published, where I found that there was no impact on household uptake of a water treatment device in schools in India. So in India, we gave, in 60 schools, we gave different, what's called a Pureit, which is a tabletop chlorine device, and in schools. And the schools that received it had no better uptake in the home than schools that didn't receive it. And we believe that it had to do with poor delivery of the behavior change model. So it was merely a infrastructure improvement, and that wasn't enough to actually get people to adopt. However, in the second bullet, the Rheingan study, this is again from the Swash Plus project in Kenya. We saw that there was a greater than 5% increase in water treatment in the home in communities where there was a school school level implementation of water treatment. So it can be done. In the third bullet, you see this paper by Oyonga Ouma, which was done in Kenya, and he did a qualitative assessment of children in schools and found that they can be, if they're systematically engaged in child-to-child learning and given specific tasks of health messages to bring home to their parents, they can be successful change agents. That's again to say that passive behavior change, just a teacher teaching, isn't going to be enough to change behavior. Programs need to really emphasize participatory methods by children. Children need to be given specific tasks, specific messages they can bring home to their families. And this final bullet, I think, by Sidibe is a very interesting study, small paper that you can see that was put out by the World Bank. And she said, quote, "Relatively simple, low-cost interventions can have far-reaching effects in improving children's hygiene practices. This is provided that they take into account motivational factors and children's sensitivities." So what we see here is motivational factors and children's sensitivities. These are critical components. She's saying that it's not enough to just have a teacher teach something about health and hygiene, but that there needs to be a specific systematic engagement with pupils in order for them to change their behaviors, change their peers' behaviors, and also promote the changes in the home. This is the last slide that I'm going to talk about for studies, and it talks about sustainability. And in 2006, there was a 2-year follow-up of a 1-year follow-up of a school-based pilot program promoting water treatment and hygiene promotion. And you see that we had huge numbers. 89% of schools provided hand washing part of the day of the site visit. 77% had residual chlorine, indicating that there was water treatment going on, and 89% provided drinking water. These are very positive numbers, very encouraging. Yet in 2008, 2 years after the end of the project, we came back and we found huge drops in schools that provided hand washing, residual chlorine, and drinking water. And that's to say it's not enough to measure the outcomes or the outputs of the program when the project is complete. That we need to start to build into our studies or our programs something like a 2-year or 3-year follow-up in order to understand really what's going on and whether our programs last. Again, it's not enough, though, to just come back 3 years after the end of the project and say, well, we saw this great decline in our outputs. It's important that we develop monitoring systems that will tell us in real time how to improve program practice. And that's what will be discussed in Module 10, where we'll talk about how to develop an integrated monitoring and evaluation system for a program, and then also to develop the accountability for the government's actors to carry out this systematic monitoring on a yearly basis in order to really know what's going on the ground. And so that we're not just wasting our time doing programs that then 2 years later don't have any effect. So in summary, there's strong evidence that wash in communities reduces diarrhea. There is limited evidence that wash in schools reduces absence, although we believe that it does. There are just few rigorous studies. Deworming is highly effective, and if we improve school wash conditions, it'll become more effective. School wash is a critical component of equity, and that touches on the rights-based arguments that we are reaching the most marginalized populations, either socioeconomically, gender, children with disabilities, children in marginalized regions of the country. This is an important avenue for behavior change and access to improved wash. Fourth bullet here is sustainability is rarely studied, but is critical to evaluate ongoing, not just at the end, not just 3 years after, but throughout the whole program to understand whether we're actually having sustained impact, sustained outcomes, whether children continue to use the latrines after they've been installed, not just on the first day that they're installed, but after 1 month, 3 months, 6 months, 12 months, 2 years. And finally, that diffusion is possible, but there needs to be systematic behavior change approaches that are used and throughout. So that's the final slide here, and I'd like to turn it back over to Murat to facilitate some questions. I've seen that some of the people are writing some questions on the side, and maybe we can get some of those questions answered. So Murat, please take over, and thank you very much.